Good evening. Tonight's lecture from Dr. Soloway in After Hour Rounds will include a discussion on fibromyalgia. Many people think they have fibromyalgia because they hurt all over. The first problem is that when people say they hurt all over, they forget that their joints are hurting as well, and joint pain is not part of fibromyalgia. In fact, soreness all over with distinctive tender points or trigger points make for a diagnosis of fibromyalgia. When a person has joint pain, whether it is your knuckles, wrist, elbows, shoulder, hips, knees, feet, ankles, toes, these people do not have fibromyalgia. They have arthritis, which can be either inflammatory or non-inflammatory. A good history and physical exam can distinguish between the two. However, I'd like to focus a little bit about fibromyalgia, my beliefs, my disbeliefs, and what I think you should know about what is called fibromyalgia. So by definition, fibromyalgia would be characterized by 9 of 16 trigger points throughout the body, which are bilateral, meaning right and left, above and below the diaphragm, meaning the chest and below the chest, and other portions of the body, including the neck and the buttocks. We have what is called placebo control points, such as the forehead, which is here, the thumbnail, which is here, and the volar forearm, which is right there, the palm side of the forearm. I hope you can see that. Okay, hopefully you saw that. So, if a patient has pain in the placebo control points, that patient has what is called a pain amplification syndrome. Okay, what I want to discuss next is the fibromyalgia diagnosis in people who are convinced they have it and they absolutely do not. I've discussed already that you can have arthritis and you think you have pain all over and therefore you think you have fibromyalgia. However, what I believe to be fibromyalgia is a little bit different, and I'm going to share this with you. I'm going to try to write this down and see if I am successful showing this, if I can switch this to the non-selfie mode of the video. I'll have you know, I write my own material and I produce my own videos by holding my cell phone in my hand. So I'm going to write while I adjust my glasses, and I'm going to see, although it doesn't look like I'm going to be successful. So I'm going to explain what I want to explain. I'm going to write it down, and once it's written down, I will show it to you. Please understand that people with fibromyalgia typically experience one of three things, and then this leads to a vicious circle. They can experience pain all over, with or without arthritis. They can experience poor sleep, and the poor sleep can be due to their roommate snoring. They can have sleep apnea, or they can just be in a lot of pain, or they can be depressed. Which leads me to the third box, which I will show you, depression. So I want to state that pain can lead to depression. This makes sense. But depression can lead to pain. Pain can lead to poor sleep, and poor sleep can lead to pain. Depression can lead to poor sleep, while poor sleep can lead to depression. So, one thing that seems to occur commonly is this vicious circle of pain, poor sleep, depression in any order seems to be self-fulfilling, and it continues to happen. The cycle needs to be broken and a diagnosis needs to be established. If a person has depression, it needs to be addressed by a psychiatrist, diagnosed properly and treated. If a person has a sleep disturbance, then the sleep disturbance needs to be evaluated often by a lung specialist who treats sleep disorders, and the test is called polysomnography. If a patient has sleep apnea, there is treatment, and by giving a patient restorative sleep will usually lead to a lack of depression and a lack of pain. However, let's focus on the pain. We've already concluded that the pain is not inflammatory and not related to joints. Those are two separate entities, inflammation and joint pain. You can have non-inflammatory joint pain or inflammatory. But if your joints are involved, it's not fibromyalgia. So what is this pain? Well, this pain often seems to come in the form of burning, numbness, soreness, muscular pain, pain from being touched, and all kinds of sensitivities. It seems that with more information and the passage of time, this often comes from dysautonomia. Dysautonomia is a dysfunction of the autonomic nervous system. The way to remember autonomic nervous system is to understand that autonomic controls automatic things such as your blood pressure, your ability to get flushed, goosebumps, sweating, your ability to have a fight or flight reflex, to keep you breathing while you're asleep, to keep your heart beating while you're asleep. All of these things are controlled automatically. If you have a failure of the autonomic nervous system, you can have many problems. You can have, to name a few, you can have gastroparesis. You can have red, sweaty palms. You can have anxiety. You can have POTS. You can have passing out, loss of conscience, dry mouth, and many, many other dozens and dozens of signs or symptoms. So, in summary, the nature of the pain, since we think it's from dysautonomia, needs to be tested by a specialist in autonomic neuropathy or autonomic dysfunction. And once testing is concluded, a cocktail of medications to help one get better sleep, ease up on the depression, and control the dysautonomia are ordered, and the fibromyalgia symptoms will go away, and there is no more fibromyalgia. Thank you for listening, and if you have any questions, please direct them to this YouTube channel, and I look forward to seeing you again. Thank you.